Good morning, Dr. Lipo, Lipo Gyno. So we have a fresh case of gynecomastia and beyond with Dr. Lipo here. 35-year-old New Hampshire. So up here in the north, cold still, freezing still, I don't know, 30s, 40s, rainy, disgusting day today. But it'll be summer soon. So, you know, we were just talking, he says, finally after years of thinking about this, and he's finally here and having the surgery. So, you know, people ask me, do I have gynecomastia? And, you know, it just means female-looking, female-like breasts. And, you know, he's got female-like breasts. Just the stuff here, and people give me crap about squeezing and this and that, but that's what they're here for, you know. All of this needs to go. We're not doing any pectoral lipofilling. He's a big guy, 7'2", not quite. But he, you know, he wants an easy, quick recovery. We're actually fighting about how far down in the belly that I want to go. But I need to break, so he's got like 3 lines here, 3 areas. 1, 2, and 3. And if I just do this, he's going to have this line here, and it's not going to look great. With me, it's all about everything. If I do this and then this, he's good. Then he's got this bubble here down to the lower belly. So we're going to do what I call the 6-pack abdomen, but with this big guy, I'm not going to etch a 6-pack. You know, with his size, he's not going to really look like he should have one. So we're going to be sculpting this, get rid of the glands, sculpting the pecs, sculpting the lats. It's all about muscle definition, lights and shadows, getting this great space here, going down to what I call about maximum point of indentation about here. We'll get a little bit over here, as he's a big guy, as long as my instruments can reach. Get down to the belly button, put a little drain in the belly button, stealth incisions, of course, armpit, nipple, belly button. Get that midline linea alba and the semilunaris. Really don't worry about the horizontals too much. I may give a little bit, so I want to etch this down, but really kind of get some lights and shadows this way and down here and kind of feather it in over here. And of course, on both sides. Local anesthesia, let's mark them, numb them, and let's hit it. We pump you up.
And we are here to pump you up.
So we're remarking just to keep this is my blueprint, basically. And if I lose my blueprint, you know, I lose my direction. And I want to make sure that everything's perfect. Lift up one more time. Yeah, we gotta save the fat. All the fat in the lats there. Vaser time. Elbow straight. Elbow straight. There you go. And I'll move your shoulder. Alright, so right now I'm attacking the gland. Really trying to get that nice and. You right? And I know I'm vasering it, especially the gland, in various levels. Superficial, just above the skin, right in the middle of the gland to attack it, and then deep, right at the junction where the gland and the muscle is. Also, I'm taking extra care. I gotta get down here. All right, so here we are at the nipple incision. And again, we're creating lines and then shadows. So the first thing I want to do, that's his belly button, that right there. I want to create this semilunaris, which frames a six-pack. Not to give him a six-pack, but to turn that way, baby. Yeah, just to frame it. Now I'm going to head lateral, and he's got this belly here, you know. So we want to go deep and superficial. Because if you just do the superficial fat and not the deep fat, if he gets fat and you don't suck out or melt the deep fat and he gains weight in a year or 2 years or 10 years or whatever, he'll come back to you and say, Doc, I gained weight and I thought liposuction was permanent. And liposuction is permanent because you don't gain new fat cells as you're older, you just get fat by each cell ballooning up or shrinking. That's how you lose weight. So what I'm trying to tell you, get the fat from the deep and the superficial compartments. Simple as that. So now we're going way lateral to his hips. As far as we can go. And down and around. And we're doing beautiful. And he's so good. Oh, yeah, good touch on. So, I'm using the micro-air. In my mind, it's the best instrument out there. I'm using a 4mm Mercedes. With him, I can do 4 or 5, but I need the extra long one, and the extra long one only comes in a 4mm. So that said, we'll work extra hard down below, easy peasy. It's a little bit bent. I bent it 20 degrees. I may use the actual 30 degree on him also. Moving forward, you know, after I do this, but we'll figure that out as we sculpt them. And again, it's like anything, this is surgery, but to me, it's more like a work of art. So, this is Gynecomastia surgery, but more, you know, it's artwork, and that's what I pride myself in doing, an artistic sculpting rather than just getting it out and being done with it. Nice fluffy fat. Should be banana strawberry daiquiri. More banana than strawberry. Fluffy fat. Nice fluffy fat. So with my smart hand, I'm contouring and sculpting it. Think of this as a peach, where I'm whittling down the peach meat by the gland. So the pit, if you know about peaches, I love peaches, the pit is tiny compared to the, you know, the peach itself. So we're whittling it down to that small pit where I can just pop that pit out without any concavity or irregularities. That's my goal. Around, I need to really etch these lats. Maintain the volume because he needs volume back here. But etch the line of the lats and to create shadow between the lats in the back and the pecs up in front. Again, artwork. Nipple incision going down, creating lines. So I'm going to first create lines with men. Difference between operating high definition with guys and with girls. With guys, you create lines and then shadows. With girls, you create shadows and then lines. So we want to create some lines and then create shadows between the lines, so that when light hits his body, you get reflection of muscle and negative spaces to give a beautiful look. All right? So I'm just turning them on the side to etch a little bit better. Get a little bit over here. I know. Hit and run, baby. This here and this. Nippy tip. Some of these don't like. Alright guys, so now we lipoed. We got 2.5 liters out of them. A little bit more. 2.5 out of 4 to 5. So just now getting the gland tissue out. Remember my analogy of glands in a 250-pound person. It's like a peach. You got to whittle out down the fat to its pit, and then you just take out the pit. Much smaller incision, and no chance of any kind of problems like indentation or concavity. And that's that. Look in there. Makes there's no gremlins just hiding. Boom. There, that's the gremlin. See now, feel for those gremlins. Nothing here. Little gremlin right here. Most of these gremlins I can just pull out. They've been detached. Beautiful. You okay? Mm-hmm. All right. Here one more time. Plasma helium gas with a radio frequency spark at the end. As you can see, it's got this little fire there, and get underneath the skin, stealth incisions, 1.5, and just really tighten this up nicely. You alright? Feel anything? Let me know. So it heats it up. Very quick healing. Heating, I mean, so it does no burning. And with anything, you gotta know what you're doing. If you don't know how to drive a car, you can hurt somebody. Same thing with a medical device. All right, Lebo Gyno, 35-year-old gentleman from New Hampshire. We did Vaser high definition power assisted liposculpture, gynecomastia gland removal, six-pack abdomen, which means from neck to the belly button. I gave him a hint of a six-pack to break up some lines and folds and rolls of his belly and sides. No pectoral lipofilling, he didn't want that. But look at the great shape and the negative space between the lats and the pecs, all the way down the serratus muscle, the midline linea alba, the semilunaris, framing the six-pack almost to the V to P, and the little bit of horizontal lines that we gave him to enhance shadows and lines of his body. Stealth incisions, armpit, nipple, and inside the belly button. We got out about 4.5 liters of fat from him, and we got our beautiful glands, and we did Renuvion Jplasma to tighten everything up. So we did it all, and we did it perfectly under local anesthesia. So if you have gynecomastia, you want Lebo, Gyno, and beyond, you call me Dr. Lebowitz, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Thanks, and see you soon.